Police say they do not believe the man accused of killing United Healthcare CEO Brian Thompson was ever a client of that health insurance company.
Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever.
Overall spending on healthcare has doubled over the past 2 decades, reaching $8.5 trillion in 2019.
Healthcare, it's one of the most debated topics of our time. Costs are skyrocketing, wait times are increasing, and patients often feel stuck in a system that's failing them. Politicians and pundits propose solutions ranging from more government control to fully socialized systems. But what if there's a better way? What if the answer lies in more freedom, not less? Today, we'll explore a libertarian approach to fixing healthcare and why empowering individuals and markets could be the key to building a healthier, fairer society. Before we dive into solutions, let's take a closer look at the current system. In the United States, healthcare is often described as a free market, but that's not entirely accurate. What we actually have is a heavily regulated and distorted system where government policies play a significant role in driving up costs and limiting choices. From employer-sponsored insurance mandates during World War II to the introduction of Medicare and Medicaid in the 1960s, government interventions have fundamentally shaped the healthcare landscape. While these programs aim to improve access, they've also created unintended consequences like inefficiency, overregulation, and spiraling costs. Here's a striking fact. In the US, administrative costs make up nearly a third of total healthcare spending. Why? Because the system is bogged down by red tape, compliance requirements, and third-party payers. Patients rarely know the true cost of their care, and providers are often incentivized to prioritize paperwork over patient outcomes. So what's the libertarian critique? At its core, libertarianism values individual choice, competition, and accountability. In healthcare, this means reducing government interference, increasing price transparency, and empowering patients to take control of their care. Let's start with price transparency. Imagine walking into a grocery store where none of the products have prices, but you only find out the cost weeks later when you get the bill. That's essentially how healthcare works today. Without clear pricing, patients can't make informed decisions, and providers have little incentive to compete on cost. A libertarian approach would mandate price transparency, ensuring that patients know the cost of services up front. In fact, some healthcare providers already do this. Direct primary care clients, for example, charge a flat monthly fee for unlimited access to a doctor, eliminating surprise bills and reducing administrative overhead. Next, let's talk about competition. In many parts of the country, healthcare is dominated by a handful of hospital networks, limiting patient options. Certificate of Need laws, which require government approval to build new healthcare facilities, stifle competition and protect incumbents. Repealing these laws would allow new providers to enter the market, driving down costs and improving quality through competition. Think about industries like tech or rail, where competition has led to incredible innovation and lower prices. Healthcare could do the same. Now let's address insurance. Under the current system, insurance often acts as a middleman, inflating costs and complicating care. Libertarians argue for reducing the role of third-party payers by expanding health savings accounts or HSAs. With HSAs, individuals can save pre-tax dollars for medical expenses, putting the power of spending directly in the hands of patients. This encourages smarter healthcare decisions and reduces reliance on insurance for routine care. Another key libertarian solution is deregulation. For example, telemedicine has shown incredible promise in improving access to care, especially in rural areas, but outdated laws often restrict doctors from practicing across state lines, limiting the potential of this technology. By removing these barriers, we can make healthcare more accessible and affordable for millions of people. Let's summarize the key points. Number 1. Price transparency to empower patients. Number 2. Competition to drive innovation and lower costs. Number 3. Expanding HSAs to put spending power in patients' hands. Number 4. Deregulation to unleash innovation in telemedicine and other areas. But what about the critics? Some argue that libertarian solutions would leave the most vulnerable behind. It's a valid concern, but it's worth noting that many of the problems in today's system disproportionately harm those same groups. For example, high costs driven by government regulations often make care unaffordable for low-income families. In a libertarian framework, community-based solutions such as charitable hospitals and mutual aid societies could fill the gap. These institutions existed long before government programs and often provided more personalized care. The bottom line is this: a libertarian approach to healthcare is about trusting individuals and communities to make the best decisions for themselves. It's about unleashing the power of innovation and the competition to create a system that works for everyone. The healthcare system is broken, but government control isn't the answer. By embracing liberty, choice, and competition, we can build a system that's affordable, accessible, and effective. If you found this video insightful, don't forget to share your thoughts in the comments down below. Let's start a conversation about creating a healthier future for all. Thanks for watching, and I'll see you next time.